Live, love, learn, life. Welcome to 4L Education. My name is Jim Oberlander. I'm a clinical nurse faculty, and that's what I've given my life to over the course of the last 7 years. Today I'd like to take you on a virtual field trip of sorts to some different locations that might offer insight and food for thought to other clinical nurse educators. Ready? Here we go! Hello. I'm going to talk a little soft because we're at the library. This is the first stop in our virtual field trip. I want to focus on one of the current buzz phrases of the education system right now. It's critical thinking. Right, critical thinking. But truthfully, I believe that concept should change to critical application. Because personally, I believe anybody come to a library, online or virtually, read some stuff about something, but then not do anything with it. But in nursing, we have to teach the students to take what they've thought about in class and apply it in the real clinical practice environment. That's right. I know you and I both have experienced those students who get it up here, but they can't put it into action. So how is it that we get students to critically apply information in the real world? Questions, questions, questions. If I could say it any louder, I would, but I'm in the library. That's how. Questions. We must learn the power of effective questioning. I mean, how many questions would we get if we read all these books? We'd have a bunch, because books, content, aren't going to always provide us with answers. And neither should we provide our students with answers all the time. That's right, I'm saying, let's give them more questions. The power of a question, though, isn't in an answer. It's in the response that we give. We must encourage students both in right and wrong answers. We must allow for failure, for wrong answers, and then guide them through towards the right answer, without judgment, without hostility, without sharpness, without sarcasm. We must help students realize the critical application that can come through understanding the why behind the answer. So even if they give us the right answer, we should still ask more questions to get at the why they chose that as the answer. Critical application is a journey, not an answer. So what questions do we ask? And that's a great question. My favorite is why. I'll just say, why? Some other ones might be, what next? What next in the nursing process? Or what would the next step be? Sometimes I'll even ask, are you sure? Are you sure that's the answer you want to give? Can you explain that to me differently? Maybe I don't understand how you're answering the question, and just say, explain that differently. After students answer, again, the power is in our response. Maybe we even follow with more questions. Ultimately, depending on their level of knowledge, how many classes they've taken, how many books they've read in class, I'm aiming at giving as few answers as possible. I want them to find the answer. Instead, I want to simply guide students through the maze of information so that when they emerge on the other side, they came up with the answer. They came up with the answer. They're going to grow in their confidence, not me. They answered the dilemma, not me. I just helped guide them through it. This is how students are going to experience those aha moments that we talk about in education, where they really get it. And this is the best gift that an educator can both give and receive from a student. Just remember, the learning process, questions are more important than answers. Thanks for spending a few moments on this virtual field trip. See you at our next location.